And we need to hear from you. I was curious about the funding for PSARC, whether $300,000, how far does that take us? Does that only fund 1 year, or will that continue the funding for longer?
Just 1 second before we can let Dr. Matos go. Yeah. You don't have a question for her?
No.
She has to leave. Okay, thank you so much. Yeah.
Thank you for the question. And before I answer, let me just reiterate, I'm with the Women's Law Project. I'm not with PSARC or with Drexel, but have had the opportunity to speak with them. So the funding right now, primarily, well, really only the revenue that comes in is from a rape kit by rape kit, person by person reimbursement. So up to $1,000 from the State Victims Compensation Program. Mm-hmm. So part of the challenge is that can vary year to year while we've got all these fixed costs. So my understanding from the current expense budget is that $300,000 would close the gap for a year, right? So that sort of investment is what would be needed year over year.
Okay, thank you so much. I appreciate you. And my apologies to everyone, but I have to leave early too. But thank you. We are listening upstairs, without a doubt.
Thank you, Councilmember Landau. And yes, it's all recorded, transcripts, so we'll be digging deep. I wanted to ask you, Ms. Lovak, about this issue that Councilmember Landau touched on. How is it that, and we've talked about this, but I want to go on public record. How is it that this is a privately managed space when there's a crime in our city, the city services go out, police, prosecution, all of those things happen, victim services. How is this not included in that continuum?
Well, I can't speak to why the city hasn't invested before. I can certainly speak to the evolution and it, sort of being placed at this intersection between healthcare and victim services, right, as a forensic exam. It is certainly the case by state law that if a victim presents at a hospital and that is where they want to receive a forensic exam, that the hospitals are required to do so. But it's my understanding that victims by and large are being cared for at PSARC now because of the reasons I described before, that it really is well set up to provide these specialized services and alleviate some of the barriers somebody might face in an emergency room. So I think it's a mixture of really good intentions and some unusual history in what was put in motion 15 years ago, and then it sort of took on a life of its own. As I mentioned, Hahnemann closed. PSARC is in this space that is city leased. It is co-located next to SVU. So there's a lot of collaboration with the city, but it has, I think, kind of fallen under the radar as a city service.
It seems most logical if they're already working with SVU, they're already in city-owned space, that this should be potentially underwritten by the city. And in addition, I do think hospitals who are not having to provide this care. So I could see a mixed model where, one hospital is providing this care, and this $300,000, if it were allocated, they would continue to provide this care at that location?
So that's really a question for Drexel. But I certainly agree with you that hospitals need to be at the table too. This is a shared responsibility, particularly when we think about what's best for victims and wanting to sort of have a no wrong door of entry, right? Some victims want to be making a report to police and want to have both the forensic exam, the care, and a report to police, and some want to stay anonymous. But things like prescription drug costs, so prophylactic medication for HIV is extraordinarily expensive. And that could be provided in an emergency room, whereas, if that's being provided out of PSARC's pocket for many patients, that's really a budget change. So I agree. I think having the hospitals at the table, having the city at the table, and the current operators of PSARC at the table is really what we need to to maybe not fully reimagine, but consider what the next best steps are.
And we need it to be a sustainable model.
Absolutely.
Because we can't go year to year putting people at risk. Until rape culture is eradicated from this globe, we're going to need these services, sadly.
Unfortunately,
You know,
I agree.
and you said there was a 5% increase that you saw in the services provided by PSARC, which could be because more people are coming forward. Hopefully that's it, and not because there's actually been an increase. But, you know, the goal here is to reduce and eliminate rapes, right? This is the power dynamic we have to level. But up until that point, we have to have resources in a sustainable manner. And I look forward to potentially getting PSARC at the table to divvy up how we get participation from sort of a multifactorial way to address this, not only this budget gap, but to put this on the front burner instead of the back burner, right? This is the goal for this entire hearing, is to push things to the forefront, because it, again, is speaking just economically, it makes more sense to do that at the, you know, and we benefit economically from that when we have a victim who has gotten all the services they need and make sure they're whole and they're moving forward, right? We are all economic entities, so I think it just boggles my mind how this has not been a part of what we do if police services or all these other things are already in place. So we are definitely going to be focusing on that. Do you have any questions for Alila? She also